molecule to worsen your gastroparesis. So ideally your GLP inhibitors and all those things you're not supposed to use if you're going to consider a patient with gastro. That's a strong recommendation. Apart from that, in the Indian scenario, 5% of the population in diabetics will be having evidence of gastroparesis. But how are you going to recognize? Again, still a question mark. Apart from that, your functional dyspepsia, your gastroparesis, all those things will coexist. Even if you're going to look in terms of functional dyspepsia, it will be coexisting with your irritable bowel. If the patient is having coexisting irritable bowel, for example, if the patient is having in the background of constipation predominant or in the background of your diarrhea predominant, IBS, and if you're going to have the presentation of your dyspepsia, bothersome fullness, bloatedness, most of the patient in Indian scenario will be type 2 diabetes, obese population, your waist circumference will be high, all those scenarios will be a very tough target to identify these kind of patients. And once, if you are going to diagnose, whether it is going to be associated with peptic ulcer or your GERD or your esophagitis, or this is because of your functional dyspepsia, or this is because of epigastric pain, or if it is because of your postprandial distress in functional dyspepsia, how are you going to recognize all this? And once you're going to recognize, whether you're going to subject only with the endoscopic or whether you're going to subject the patient with other blood and investigations. Because most of the patients who are being presented to us will be having signs of dysphagia. And it might be in a late adolescent phase, or it might be in adulthood phase, or whatever it is. So how are you going to recognize? So that's one of those characteristics even. And all the dysphagia you are referring to, this might be considered one of the common differential diagnoses. I mean, one of the most common abnormal findings as an alarming point as a red flag, which should be considered in the workup. And all the patients are going to subject for endoscopy, you're not going to identify a finding. And moreover, your manometry, as you modified kind of guidance, you're going to diagnose your case as per our discussion. The second thing is functional dyspepsia. It's very characteristic. And third thing will be your irritable bowel along with your chronic constipation. And functional dyspepsia, if you're going to look into that, has already been discussed. Around 80% of the population will be having predominance of functional dyspepsia.